some abdominal exam. So first we're gonna go and palpate the abdominal aorta. So to do that, we're gonna go about 2 finger widths away from the umbilicus, and you're gonna press down with firm pressure until you feel a pulse. And then once you feel it, to check the diameter of the aorta, you're gonna kind of roll off medially and laterally. And there's nothing abnormal jumping out, so I think that's pretty normal. Then we're gonna find and palpate the appendix. So to do that, we're gonna locate the ASIS here, and then we're gonna go from the umbilicus to the ASIS about 1/3 of the way here, and with firm pressure you're gonna push down and palpate, and then you're gonna release really quickly to get a rebound. And if there's any pain or tenderness there, that would mean inflammation, but there's not, so we're good. And then from here we'll go ahead and check the liver. So locating the xiphoid process of the sternum and in the hypochondral space underneath the rib, we're going to find a firm structure. Feel it there. And then to confirm that this is the liver, we're going to start at the umbilicus, apply firm pressure, you're going to do a little percussion, and you're just going to move up and up until you hear a different sound, and it's going to be more firm when you're on the liver. So then also in this area I can do an exam of her abdominal quadrants. So dissecting the abdomen in 4s, we're going to have the right upper quadrant, left upper quadrant, left lower, and right lower. And we're going to start by moving in circular motions, medially to laterally in each quadrant. Any pain or tenderness? Just assessing for any firmness, pain, or tenderness. Any pain or tenderness? Everything feels good so far. Pain or tenderness? Okay. If there was pain and tenderness, I would do a rebound test. Doing okay? Because that could mean internal bleeding. To continue, I would go back through and apply medium pressure and then firm pressure, and that's how I would assess the quadrants. Okay, so to palpate and assess the spleen, I would find the 11th and 12th rib and go to the subchondral space between there. And if the spleen was enlarged, it would be palpable. But if not, if I just wanted to check, I would do a percussion test. And if it was a dull sound, then that would be a positive test for inflammation or irritation of the spleen. Hi, I'm Taylor, and we're gonna do a manual resistance exercise for her shoulder internal rotators. So we're gonna start in a 90-degree position. We're going to start already in internal rotation, and when I apply a force, she's going to try to resist me, and I'm going to try to take her into external rotation to eccentrically strengthen her internal rotators. So I'm going to apply a force. You're going to try to slow me down, okay? I'm going to try to resist. Quick stretch here, and she's gonna push me down now, try to fight me, and that would be a concentric strengthening of her internal rotators. And then back into eccentric, and then quick stretch into concentric.
3.
Okay, so we're going to do a manual resistance exercise for her hip external rotators. So I'm going to place a pillow between me and her thigh. I'm gonna bring her leg up into 90 degrees of hip and knee flexion. I'm gonna apply just stabilization here with this hand, and then with this hand, my force is gonna be this way. I'm gonna take her into external rotation, and then to do an eccentric strengthening of her external rotators, I'm gonna manually apply a force going this way into IR, and she's gonna try to resist me. Try to slow me down. Just kind of twisting my hips. And then she's gonna, to do a concentric strengthening of the external rotators, I'm gonna apply a quick stretch here, and she's gonna try to slow me down as we go into external rotation. Very good. Okay, so we're gonna do a manual resistance exercise to eccentrically strengthen the knee extensors and flexors. So I'm gonna bring her into full knee extension, and I'm gonna apply a force downwards. She's gonna try to resist me as we eccentrically strengthen the knee extensors. Okay, so breathe and try to resist me. Now in full knee flexion here, I'm gonna switch my hand to the back so I can apply my force up as we eccentrically strengthen her knee flexors. So try to resist me and breathe. And just like that. I would repeat that a few times to help eccentrically strengthen her knee extensors and flexors. Okay, I'm Taylor. I'm gonna do a concentric manual resistance exercise for her wrist flexors and extensors. So to concentrically strengthen her wrist flexors, we're gonna come into wrist extension. I'm gonna stabilize here and apply my force here. I'm gonna do a little quick stretch here, and she's gonna resist me as she moves into flexion. And then to concentrically strengthen her wrist extensors, I'm gonna have her in wrist flexion. I'll just switch my hand here, stabilize here, and give her a quick stretch. She's gonna breathe and resist against me. And then that would be concentric for her extensors. And then we would repeat that a couple of times to strengthen them concentric.